Thank you. And our next speaker is Monique Turner. Thank you.
Thank you. Thank you. I'm going to present data to you today from a study that just finished this summer where we looked at mediated communication out of Liberia in the midst of the Ebola crisis. And I want to mention that this study was funded to Johns Hopkins University from USAID, of which Rajiv Ramal and I had a subcontract for. But before we can really talk about this issue, we should talk about the social context, because as Rajiv said, risks and crises don't happen in a vacuum. We already were told that there were over 11,000 deaths due to this particular crisis, and nearly 5,000 of them were from Liberia. Now remember, Liberia is a country that had been going through immense stress and strife. 2 civil wars starting in the late 80s, early 90s, a president who was assassinated. That led eventually to Ellen Sirleaf being elected, who is still in power now. But this was a country that had a low trust of its leaders, as I said, immense stress, and a very much so, a fledgling healthcare environment. This is a place that didn't have resources, didn't have isolation units, didn't have supplies. Many of the healthcare workers weren't trained to use supplies, even if they had them. And so all of that needs to be taken in consideration when we think about how communication was relayed. And as was mentioned earlier, trust is fundamental for both risk and crisis communication. And we're starting out at a baseline where trust was really low, all right? So our project was not looking at human perception. It was looking at how these risk communication practices, best practices, if you will, we love that term, were relayed via the media in the midst of the crisis. Okay. So this content analysis that you can see here, we coded content from a random sample of newspapers, radio and radio programs, text messages that came in from healthcare workers, and something called chalkboards, which I won't be presenting the results of today. We coded our trainers, you can trust me, very extensively, and they had a high intercoder reliability. I also want to mention while I'm here that you can see that radio is broken down both into typical radio, so you're listening to music, the DJ talks, and radio programs, which were specifically designed and implemented by Johns Hopkins University as part of the project. So you can almost think about the radio programs, Youth Talk, Radio Joy, etc., the 55 that we coded, almost as an intervention. And we can see whether or not that communication is significantly different than newspaper and typical radio, which was organic, right? Not designed by our team. All right. We coded for everything under the sun. Obviously, I won't present all of that today. It was a 25-page code book. It took months to train our coders, but we wanted, while we had this content, we wanted to make sure that we got as much data out of it as we could. Our code book was primarily developed. There were themes underneath each of what we call the best practices of risk or crisis communication, everything from rumor control, which I will discuss today, to stigmatizing communication, trustworthy and expertise, etc. All right, so here are some findings that I think are relevant for today. So first, we really want to talk about across newspaper, across radio, across text messages, who are the sources of risk communication? Who is either being cited or explicitly interviewed? All right. And if they are cited or interviewed, is it ever mentioned that they're an expert in the topic? Is it ever implicitly or explicitly mentioned that this is a trustworthy source? Likewise, is it ever mentioned that they're not trustworthy? All right. So I'm going to show you a very ugly table, and I'm doing it intentionally because I want to show you how we looked at this. All right. So I want to present something. So here are a variety of sources that were presented across modalities. You can see the Liberian government cited actually the most. We separated out Ellen Sirleaf here, who is the president, from the African Union to the CDC to the US government. The Liberian Ministry of Health is here, etc. So what we looked at, and what I want to make obvious to you in a second, is we looked at whether or not they were cited at all. Was their expertise mentioned? Was their trustworthiness mentioned? Or was a lack of trustworthiness mentioned? All right. First finding that I want to talk to you about is that it varies from radio to newspaper, and I'll go deeper into that in a second. The second finding I want to mention is expertise is relatively easy to communicate, especially if you talk about somebody's credentials, then we coded that as having expert communication communicated. Trustworthiness was almost never communicated, never. But lack of trustworthiness was. So it wasn't an unwillingness to talk about trust. It was rather that these media outlets thought it might be pertinent to mention whether or not somebody is not so trustworthy, but did not do the opposite in cases where they thought they were trustworthy. All right. So that's too ugly to look at. So let's move on. So first off, let's look specifically at who was blamed for the Ebola crisis. So the first thing you can see is that blame depends on modality, all right? In newspapers, the Liberian government and Ebola itself are the two most common sources of blame. These are the things, if you will, or persons that caused this to happen. And as I'll get to in a second, I literally mean caused. There were a number of rumors that came about, more on that in a minute, that explicitly indicated that the Liberian government brought Ebola to the country on purpose, all right? But by radio, you can see a huge difference there, right? So in radio programs, the U.S. is at fault, as well as non-governmental organizations, and most blamed no one, all right, 40% blamed no one at all. So this is really interesting because you see a huge shift in which government's at fault. Now look at the radio programs which were explicitly, strategically designed by the team. Here, all the blame is on God and witchcraft. Not the government, not Ebola itself, not the United States, not the CDC, right? But it is a naturally occurring phenomenon, all right? Rumors blamed the Liberian government most often, all right? Who was credited for helping resolve this crisis? So oftentimes newspaper, radio programs, et cetera, would talk about that we're coming out of this crisis, we're fixing this, we have hope. So who's credited? And here you can see, again, with newspapers, most often it is the Liberian government. So they're paying, fair attention to both blaming them and crediting them. And non-governmental organizations are mentioned again. So in the radio, no one is really credited except for God. So God caused this, God can solve it. And that, in fact, was much how the communication was relayed, right? What God has caused, God can fix. Now, that is a problem for those of us that are trying to engage human action to reduce harm, okay? In the radio programs, it was also 100% God. All right. So this is what that looked like, right? We want to be grateful to God. We know this was divine intervention, right? And this is how Liberia got to where it is now. And we saw many quotes like that. Now let's talk about a specific kind of communication that I have a sense you're interested in because we've been talking about false information, right? How do we control it? And this particular project had a really, I think, fantastic way of dealing with this. It wasn't designed by me, so it was really wonderful. So what they did is, first of all, there was a coordination center in Liberia, in Monrovia. And first off, they asked community health workers to keep their ear low to the ground, if you will, and text in rumors that they hear to this 1-800 number. It's not literally 1-800, but that sort of thing. And so they started collecting rumors, and we had a big spreadsheet of all the rumors that started coming in. Now, as they came in, the team put out a newsletter that went out to network members as well as other working groups, but most importantly, they trained the media. They trained the media on what rumors are coming in, what rumors are prevalent, and to debunk those rumors when they mention them on the news. Does it work? All right. So first of all, let's look at the sources of these rumors. And most often, rumors are communicated by the community. We didn't see doctors very often. We didn't see healthcare workers very often spreading rumors, or any of the other sources we coded for weren't spreading rumors at all. It was primarily community members. All right. Now, this is the data from the rumors that came in from the text messages by the community health workers. And you can see some of the common ones are, for example, rumors about new Ebola cases where that was unverified. We had no proof whatsoever that new cases are emerging, but there were many rumors about new cases. There was also a number of rumors about people who were profiting from Ebola, and so they didn't want to control Ebola. And finally, that Ebola was not a naturally existing occurrence, but it was created by an outside source, like the United States or like the Liberian government itself. All right. And here's a look at blaming within rumors. And when these rumors were blaming somebody, it was typically either the president or the government, generally speaking. Now, here's the question: can we control these rumors, right? Were they debunked? So what you see here are rumors over time. And the time period of the crisis, we broke down these 2 years into 6-month periods. So you can see the Liberian crisis over time. And over time, rumors increased by a lot, all right? That's probably expected. Refutations, it doesn't look like, in this analysis, increased as quickly as did the rumors. But we did another analysis where we looked at whether or not the rumors were addressed in the newspaper article. So here you can see the purple line is addressed, and those are the refutations minus the rumor itself. And what we see is that over time throughout this crisis, as rumors were mentioned, they were simultaneously debunked. Okay, and so here is evidence of where a built alliance and a strategically thoughtful process, and we're going to collect the rumors as they come in a dynamic fashion. We're going to train the media as we go. We'll build an alliance with the media, and the media can communicate to people that this is a rumor. It is not verified. So this is really the crux of what we want to look at, where rumors are debunked at the same time. So my time is nearly up, so here's what I want to share with you. First off, the reason that we looked at media versus human perception, and typically my work is on human perception, is because perception is reality, right? It doesn't matter if you are trustworthy. It matters if the public thinks you are trustworthy, right? Same as with credibility, expertise, etc. So we wanted to see how is that being conveyed in these major outlets, newspaper, radio, text messages, etc. And we wanted to see whether we could actually build an alliance with the media that would help us debunk rumors as they come in. And we could. We were absolutely able to do that. Now, because we don't have human perception data, we don't know whether that changed perception. That definitely should be a future study. But we know that we need to look at media to understand what messages are out there influencing human perception. So that's the takeaway, I think, and many of you were asking about false information, et cetera, is that I think that with strategic thought, it is possible to control rumors as they happen.